Well, today is September 15th. Sitting here with Coronda Burns.
2011.
So, have you been having any complications lately?
Yes, I've been in a lot of pain lately. My baby's trying to rotate, and it's affecting my chest and my lower part of my stomach.
What way is it affecting you? Like, what do you go through daily when you carrying this child?
You don't want to know. Go through a lot. It's mostly a lot of pain. I don't know. I feel like my intestines or something ripping. I don't know. My stomach ripping it. I don't know. I feel like skin, flesh tearing mostly. But it's crazy to deal with. Especially when you go to the emergency room, they don't help.
What's the most? Now you had something go on last night, right?
Oh yeah, my baby was rotating. It looked like I had an alien in my stomach. He was poked out on one side, and my back was hurting real bad. My stomach was hurting real bad. I don't know. I feel like my hips about to come out the sockets. It's crazy.
And what kept you from going to the hospital?
I don't know. I guess because they won't help me. They ain't helped me before, so I just sit through the pain and cry it out.
And you say they don't help you. When you do go, what do they do?
Oh, they tell me I need to find someone else to deal with the situation, or they'll try to shoot me with a lot of drugs. I think they're trying to kill the baby, but I don't know. They told me if I don't take the high potency pain killers they try to give me, they told me I have to leave the hospital. That's great.
So do you want to go to the doctor?
Yeah. I want to go to a doctor that's going to help me. That's the problem. I don't want to go to a doctor that's just going to say, oh my God, you should be dead. That's mostly what I hear. You should be dead. This is not medically possible. You should be dead. That's all I hear.
And that kind of keeps you from going to the doctor as well?
I mean, well,
because you already
been put out so many times. Every time I go to the hospital and they see it, they say, wow, this is not medically possible, but you have to leave here. But a guy taking care of me though. He is taking care of me. Very much so. I can't complain. It must be something I have to go through. I mean, I really don't know what to do now. I'm just living life, I guess. I don't know. It's crazy. You would think that some doctors would want to help. But I don't know.
Yeah, that's sad.
It's crazy. It's more crazy than sad. You know, especially a doctor, somebody go to school, have degrees. And the only thing they can tell you is that you should be dead, but you need to leave my office. Man, it's crazy.
So just last night, what could you describe the pain as?
Oh my God, it was like somebody took a machete and just chopped me up in the inside. It was so painful. It was horrible. I mean, I really can't explain it, but it was, I don't know. Feel like he ready to walk out. I don't know what's going on. One hospital told me if I'm not bleeding, don't come back to the emergency room. Okay, cut it off. After 4 years, what do you do? It's crazy. But you know what? This has to be proven to a lot of people, though. Just a whole lot of people don't believe. My family members. I ain't gonna say friends because I ain't got none of them. Associates. You know, so. But you find out a lot about how a person is to go through something. And God say he'll stick to you closer than a brother, closer than a friend. He wouldn't lying. Because everybody else gonna walk away from you. Look at you like you crazy.
Does that hurt for like everyday walking and talking and stuff?
Yeah, it hurt to walk, but I force myself most of the time to do what I have to do. Because my hips feel like they actually about to come out the socket. That's how. I mean, it's like, ain't no pushing it. Sometimes when I'm in the bed, it feel like they pop in and out of socket. And when I stand up, it's hard and I got to pop them back into place. But it hurt though. You know, to walk. Or like if I sit too long, it hurt. You know, like I said, it's just pain because it's getting, you know, my baby getting bigger. I only got so much. Inside, they say all of my organs are compressed up against my abdominal wall. And all the ones above my diaphragm are smashed up in my chest. The top of his head is on top of my chest. That's why my voice is so deep. And the top of his head is right here. I got a fast heartbeat. Everything. Like it hurt when he tried to move his head from side to side. I almost feel like I'm about to have a heart attack.
Oh man.
Like I can't lay flat. That's horrible. But it seems like sometimes when I try to lay flat, he pushing me opposite. I had my lung. I started coughing up. Started coughing a lot. It's like he started taking my breath from.
So how do you sleep?
I sleep. Most time I take a nap. I gotta go to the bathroom almost every hour, so it's like a nap. For real, like a power nap. I do that and up, down. But I sleep like at an angle. I can't lay flat. Like I can sit up and, you know, sleep pretty good. Or, you know, sleep on the side.
Like sitting on the bed?
I have to have a lot of pillows on my back, supporting me up. I can't sleep on my stomach, my back hurt, my side hurt. I was always used to sleeping on my stomach. And it's weird to try to sleep on my back. I know there was a person that could sleep on my back, but now I ain't got no choice. As long as I don't lay flat, I'm keeping. It's crazy, man. Just to feel something inside me move. It felt like he was trying to push my intestines. I don't know. Something coming through my nose.
That sound like that?
He be moving like. Anyone that's been pregnant, you know what I'm talking about. It's just crazy because it's in my body. You know, I can feel them like hit my organs or something. My organs be fluttering. It's crazy. Oh. So that's why I feel like sooner or later you're going to have to bust up because this pain is horrible. Most of the top part of my stomach is numb. And the doctor said it's because everything is smashed against my abdominal wall.
So it's moving right now?
Mm-hmm. All of the movement doesn't hurt, but sometimes it depends on what you're doing.
Sounds kind of angry.
I mean, it's just something I go through every day. I mean, it's, oh my God. I just feel like so much pressure, like you pushing. And it be just, up in here, it's just horrible. Like I said, it be feeling like he cutting something on. I don't know what he's doing. Tearing skin or something. This is the paperwork that shows that my liver is in my hip. This is my results from my imaging scan. And it's an abdominal CT and pelvic CT history. And it's showing that where the liver is enlarged within the lower margin of the liver extending all the way down in the iliac crest, which is the hip or whatever. And these are pictures of the baby's back.
What year is this?
As he's sitting inside of me. And this was 09. And as you can see, this is the baby's back, which looks like a full back, you know. And as you can see me out to the sides, that's a pelvic area. And when I go to the hospital and they see this, they say, ma'am, that's the pelvic and spine of a toddler. I say, okay, well, how did it get inside of me then if I haven't been pregnant this long? And they always say, ma'am, you're delusional, but leave before I call security. So nobody wants to know, how did the toddler get in me if I haven't been pregnant for 48 months? Because the doctor specifically said that's the bone structure of a toddler, ma'am. I mean, you know, I don't know what else to do. And it's just a few other shots of the skull, which is behind my organ. The whole baby is sitting in my middle section, behind my intestinal wall.